Well, hi, everybody. I'm Tracy Jacim, the president and the CEO of the Florida Breast Cancer Foundation. And I want to begin this afternoon by thanking everybody for logging on and joining us from your homes during this time. It's a difficult time, and we're here today to hopefully make it a little easier for you. I also want to thank our panelists. Thank you all for joining us. If you look at your screen on your far right, we have Dr. David Molthrop, a medical oncologist with the Florida Cancer Specialist. Thank you for joining us.
Thank you.
Moving to the left, as you're looking at the screen, we have Dr. Aurelio Castrellon. We had a discussion prior to this. My Spanish is a little lacking, so forgive me, but also a medical oncologist with the Memorial Health System, specifically the Memorial Cancer Institute. Thank you so much for joining us, Doctor.
My pleasure.
And lastly, but certainly not least, we have Ms. Kim Praitano, the president and the CEO of Gilda's Club in South Florida, a nonprofit that does a lot of great work that we work with very closely, and we have funded some programs. We're currently funding programs, and we're so happy to have you join us too, Kim.
Thank you so much.
Well, thank you. And again, you know, the reason for this is very simple. We know that breast cancer patients, some breast cancer survivors, depending on where they are in their journey, and of course the caregivers, all face unique challenges during COVID-19. And we've been getting a lot of questions at our nonprofit. And so we want to afford you, folks at home, the opportunity to ask those questions directly. Our mission at the Florida Breast Cancer Foundation is to help you, to advocate for you, to empower you, and to educate. So that's what this hour is all about. So thank you all. So right now we're waiting for folks to send in some questions. And for those at home who are joining us, if you would, just on the comment section on Facebook, go ahead, type in your question as you listen to our discussion. Feel free to ask anything and we will do our best to answer it. While we are waiting though, I have a slew of questions that we've gotten from the folks that we serve. Phone calls, emails, and such. And we'll begin with one of the most basic, and I'm going to put it to our doctors. We'll start with you, Dr. Molthrop, on the far right, and then we'll move left. Let's talk a little bit about mammograms and just regular routine screenings. What is the status of those right now? And I've had so many people say, look, I'm due, what should I do? What should they do, doctor?
Right now in the state of Florida, there is a state edict that says that non-essential tests and services are now considered, banned is a strong word, but that's basically what's happening in a lot of centers. And there's some interpretation to this. Obviously, there's concern, especially in our patients, about, look, I've had breast cancer. To me, it's essential that I have these tests done in a timely manner. And as you know, some of these patients who've gone through this had some delays the first time before they were diagnosed, and it causes all sorts of anxiety. But as of now, this is still considered a non-essential service. We're very hopeful that this will change in the near future. Now, it's different if you have a mass, something that's concerning, that a previous mammogram that's abnormal. Sometimes we can get patients in, but it's been difficult to get routine screening mammograms approved, at least in this area where I am. I don't know about you, doctor, but that's what we've been having a hard time getting the routine mammograms done right now. How has it been for you all?
Well, for us here in Broward County, yes, you know, following this whole COVID-19 pandemia, things have been changing, as you can see, pretty much day by day.
Right.
And the restrictions that were applied to the institution changed from one day to the other. And then we went through a period of time where all of these non-essential procedures were pretty much on hold. We have resumed slowly, and what we have implemented is that all of the patients that are in follow-up, whether they're every 6 months or 1 year, patients that are on maintenance anti-estrogen treatments, but they have finished already the initial part of their therapies and had their surgeries, and they're basically in the follow-up period. We are contacting them via telemedicine, and they have had some of them, their mammograms recently, some before they started. So what we're doing is that they just pass by the center, have a blood draw with necessary labs that we check, and then we're calling them with the results and go over their imaging. And that way we're limiting the people that come to our center to only the new patients, new diagnosis of breast cancer that are in need to start treatment, neoadjuvant therapies mainly, and our patients that were already on therapies and have already started treatment and are getting infusions or some of the oral treatments that can also cause lab abnormalities, and you have to be checking them between every every month or every 2 months. They have been coming. So we've reduced like maybe 80% of the patients that come to the center, and we're working with the 20% that are in high need for services right now. The other patients haven't been neglected. They are being contacted, but it's mainly via telehealth for now until, you know.
Maybe
So that's how we have approached it. But yes, we're starting to do mammograms and ultrasounds for the breast and even MRIs again here at Memorial, but they have implemented screening methods, and they try to make the waiting rooms very low volume, and so the hospital is slowly trying to get back to how we were functioning before the pandemic. Yeah.
And I think as well, Governor DeSantis meeting with his task force, we're about to see some changes. It's got to be very challenging for you all. So let me also at this moment thank both of you, doctors on the front lines. They're doing what you do. I have a question from Gina, who says that she has a family history and she missed her mammogram, unfortunately, 2.5 months ago, and now she was canceled on. Let's talk a little bit, just briefly, if you would. What would you say to someone like her, who is in a higher risk group, and now she's in this situation where it is just a screening? And I know you sort of spoke to that already. The screenings are considered non-essential, but what would you say to her? She's very worried. What can you do to ease her anxiety?
Well, I mean, it's difficult to ease people's anxiety. There's a lot going on right now. They're also cooped up at home. You're dealing with the family history. You know what's going on with this disease in your family. And there's no easy words to this. What I would say is to be persistent, because I think this is changing quickly. I think that, you know, there are some centers that are open. So if you're used to getting your mammograms at one place, you may be able to find another center and you can pick up your discs and be able to do some of those things where you can find another place that is open. And I think it's become much more likely over the next few weeks that people will be able to get testing done in a more timely fashion. So I'm hoping that this part of the problem will start being solved in the near future with appropriate social distancing and screening of patients as they go into these facilities.
And I think you both answered the next question that's come in, but I'm going to read it just so Migdalia Ross knows that we're listening to you and we have your question, Migdalia. We thank you for sending it. And the question is it essential? Is it essential a routine visit to your oncologist? I'm a survivor and had my visit in May. And I think you sort of just touched on that, right? Things are changing. And if you have something to add, go ahead.
Well, I think it's just exactly what Dr. Castrellon said, is that our follow-up visits, we've been able, I think, pretty nicely to do these by telehealth, send out prescriptions for labs or have patients come in for their labs and so forth in a screened fashion. So we're working around, but completely understandable. You know, one of the things that's so important about follow-up visits is the psychological support that they get from the support staff, from our nurses and our extenders and so forth. It's not just about getting the blood work and so forth. It's just being able to see a face and say, have reassurance that people are paying attention. Because a lot of times the patients who finish therapy feel like, look, I'm not actively being treated. Are you still paying attention to me? So that's really important. So they're doing telehealth, we're doing telehealth, but we're looking forward to those face-to-face visits again, I hope, in the near future.
I'm sure you are, and that kind of lends itself to a discussion with you and I, Kim. So Kim Praitano, again, with Gilda's Club South, and actually Florida Breast Cancer Foundation and Gilda's Club South working right now on a support group that is a little different than getting it right from the doctors, but also it is a way perhaps to help with some of those concerns and to share your experiences. Talk a little bit about what you're hearing from folks, Kim. The first support group was held this week, and how you're addressing some of those concerns.
So prior to the pandemic, our mission of Gilda's Club is to specifically work with that anxiety and depression and the things that go along with a normal diagnosis, and the anxiety that goes along with going for your regular visit and not being able to get it. So our breast cancer support group is a confidential group. It's free of charge, and right now it's online, and so people can contact Gilda's Club South Florida. It's funded in part by the Florida Breast Cancer Foundation. So we're partnering together to ensure that people get these services even through the pandemic, as well as after. Our services will still be free, and right now you can contact us, go online, and you can get the support of a professional mental health counselor, as well as the others in the group. That really is the point of it, to deal with the things that you can control.
Yeah, exactly.
And to alleviate some of that anxiety. There are things that we're not going to be able to control during this pandemic, and we have to understand what they are and then understand what we can do.
And you do it well. And, you know, and that's something just to remind folks listening, just like the doctors, we are, I think we're all finding ourselves working pretty hard these days, just working differently, because the cause is important, of course, medicine crucial. This is from Chabi, actually, within our staff. He's trying to get some insight, personal insight from the docs. What are your thoughts and recommendations about reopening the schools and businesses in the next couple of weeks? I would be interested too to hear your thoughts on that. Either doctor can begin.
I'm going to defer to him on this one. This is
very clever move. Very
I'll take it second.
Dr. Castrellon?
I'm going to defer to the governor of the state, and the statisticians, and Dr. Fauci and company, and all of those people.
I'm sorry.
I'm going to take the politicians out. I'm going to defer to the scientists. How's that?
You know, we're working in this together. We're working in this together. You know, I think honestly, this is just my personal perception of what's been happening. And let me just talk about the center, because that's where I've been. I think we can slowly start resuming activities, keeping all the precautions, the social distances, now that we are aware of what this is and what this is capable of and how easy it is to contract it. I think as a society, we should be able to increase the amount of new infections and sort of starting getting back. Now, about the schools, you know, kids, I think that's tough. And, but other things, I believe, at least speaking for the hospital, that we should be able to start moving, you know, slowly to starting to work, not obviously at full speed, but increase the speed that we have been.
I agree with the hospitals. I think they've already put into place all these really excellent screening tools, yes, and they function in a way that I think is maximum the idea of protecting our patients and patients' families and so forth. But I would really love to see that degree of concern in other areas of our society before things completely open up. Unfortunately, I think we see over and over again, when we don't have structures in place to protect people, not everybody follows the rules. And it's very strict here, the way things work around the hospital. And I'm sure it's very strict where you are as well. And those precautions are what really help people and save people's lives. And that's why it's tough. And listen, you know, we would be wrong to ignore the idea that there are people who are suffering greatly, and there are probably people who will even die because of all of the stress involved with not having a job to go to and not being able to socially interact with the groups that they've been able to. And so depression and suicide and all those things are major issues here that aren't going to be counted as deaths related to this pandemic and the shutdown. So these are all things that smarter people than I have thought about. And I agree with you, as long as we try to provide sort of unified guidance and so forth, and understand that when we open things up, we have to do it in a way that makes sense for the safety of all of us.
David, what are your thoughts about the general use of masks across everyone out there on the street? Doesn't matter who you are or what you're doing.
Right, and I think there are two reasons for that, right? One is the potential protection, and that's the idea that we put out there all the time, is that we know it's really impressive when they do the studies of where this viral RNA is. It's sort of everywhere. That doesn't mean the virus is there, but the degradation products near people who have been sick and so forth, they're under surfaces, they're everywhere. So the idea that the virus is out there is real. The other thing about it is if we all do that, then it's less of a stigma to the people who are doing it. You know, we're a social people, and when we see somebody that's a little different, sometimes we kind of snicker or you know, don't treat them with the respect we do. But if we all respect how serious this is, it means we're all doing our part. And that's part of like the war effort, if you will, is the idea where everybody does their part, even if it's, well, I don't think I need a mask, I'm going to wear one anyway because it might be important to the people around me. And that's the altruism that I think we need to show, and has been a little difficult. It's fine to say, I want to go back to work. It's fine to say, I would like to try to open things up and we want to make things happen. But really, if we're going to do that, we really all have to protect each other. We really have to help each other. And that's the part that I think we sometimes lack. So yours is an excellent point.
Just to take that a step further, that was one of our questions regarding the mask, and you covered it pretty well, very well actually. But again, so it's this whole idea of for the public good, if you wear a mask, it's primarily to not spread it. The question came in, what about as far as not catching it? Everything about the mask that we've heard has been about not spreading it, which is very important, like you said, in order for us to open up our society again. But just to be clear to this person who's asking this question, are the masks effective as far as not contracting it?
I think that the information on that has been all over.
Yeah.
Exactly right.
We first heard that, you know, now use them, they don't work. Then now we're starting to see videos of places that have reopened and everybody's out there on the street wearing masks. So, and these were the same places that were saying that the masks weren't effective. So
Yeah.
I would say, what's the harm in putting a mask on?
Right.
I think it will be the opposite, that we don't see people that are wearing masks as strange. I think we should start seeing people that are not wearing masks as a strange. You know,
I agree.
They're at Walgreens and they don't have any policy that all the employees there should have been wearing their mask, and some were, some others. The guy at the car register wasn't, and he's the one that's touching the most credit cards and interacting with the most people. So.
Right.
You know, I'm not sure what's going on, you know, around with this. If it's something that us as a society are going to have to come together, or do we let our governors do? I'm not sure about that. But I honestly think that the whole wearing the mask, it's probably going to be the way to go for months.
For the
And
public.
there are other thing is that there are, you know, there's sort of specific masks and differences in those masks. So the cloth mask that's available to everyone is not the most effective way. If somebody coughs on you directly, that virus might be able to get through the pores in that mask. The surgical masks are maybe a little bit better. The masks that are best are the ones that we really can't get unless we're right in the midst of you know, those N95 masks and those things. Those are the ones that are most effective, but even those aren't effective if you don't know how to wear them, or not as effective if you don't know how to wear them. However, they're all of some benefit, okay? So I think that everybody who looks at this would say the cloth masks are not as beneficial, but they are better than nothing. And right now, better than nothing means maybe saving some lives, right? So that whole idea of maximizing everything we can do to minimize the risk for more people getting sick, I think is important. And that's one of the things we should do.
Excellent points. Thank you both. Okay, a new question. Linda Acorn-Budzinski. The Boston Globe reported today that emergency room visits are cut in half nationwide. Some doctors worry that patients are ignoring their symptoms and dangerously delaying life-saving treatment over fears they may contract the coronavirus in hospitals. Yes. Is this a real concern as it relates to breast cancer?
I don't know, Dave, you want to go ahead? I was going to make a
No,
point on that.
you take this one. I'll go after you. Go ahead.
You know, I have been talking to the emergency room physicians in our institution, getting a feel of what they are, because they're at the front line. And you know, what the physicians that are in the emergency room, intensive care unit, hospitalists, especially the nurses that have to give patients the IV. I mean, they are really the front line, and I have nothing but admiration and respect for them. We screen our patients very well when they come at the center. So, you know, I've been exposed very little to the virus as opposed to my ER colleagues and ICU colleagues, and especially the nurses at the center. I have no words to thank them for what they're doing. And there was a time that there was a lot of stuff out there that this thing can just jump from one person to the other. And, you know, the media post a lot of patients that were in an age group where they didn't think it was risky, and unfortunately, patient passed away from that, and it created a whole environment of hysteria. Like, you know, now even children can die from it, and you know, all of these things went on for days because this was something new for everyone. And I think we've learned more as time has passed by, but there's a stigma there. And the emergency room physicians have noticed that there are people that are delaying their visits to the emergency room for real emergencies. Example, a gentleman had neurologic symptoms consistent with a stroke for 2 days. He was afraid to go to the emergency room. Same has happened with heart attacks. He was telling me a gentleman with a fracture wouldn't stay. He went home with a fractured bone. And, you know, people are terrified of going to the emergency rooms, understandably. Now, the ER visits for superfluous symptoms or you know, deep venous thrombosis and things that, you know, so many negative studies that we do every day, and people just, you know, go to the emergency room very concerned, and many times we know that nothing's happening, and we have been practicing legal medicine for many years. That has also gone down tremendously. Who is at the emergency room really needs to be there. There's a real urgencies that are happening now that patients are being taken care of. But, you know, if I can give a message to patients is to not stay at home for symptoms that are concerning for something major, for the fear that you may contract this virus in the emergency room. You know, I speak for our center here. The measures that they have implemented at Memorial are incredible. No one goes to the emergency room without going to a negative pressure tent. They are being screened very meticulously. The emergency room is divided. They have a section for patients that have the virus or are on observation for potentially respiratory symptoms, and people that have different things are in another section. And we have had, I cannot share this, but the rate of infections of healthcare personnel at Memorial has been very low. I cannot say numbers, and people have been taken care of, and the recorded infections that have happened in the emergency room as a result from people visiting there, extremely low too. I cannot say numbers, but what I can say honestly to people is that if you have a symptom, something that's concerning, you're fearing for your life, don't delay your visit to the emergency room for the fear of contracting this virus, because, we know the vast majority of cases, people are going to have, symptoms. And I honestly have had patients that were on chemo that suffer from the COVID, and thank God they have recovered completely. We have tested them now negative, and they're ready to get back on therapy. And so they did well. No, not all the cases are as sometimes the media portrays it. So I think there's been a lot of fear that we have to start now leaving aside and starting to, think the right way, take the right precautions, and not let something that could have been treated in a timely manner and save somebody's life, and then we're losing that life because of the fear of something that, there's a little chance that could have occurred.
Mm-hmm. I think both of you brought up great points. And if there's one thing I want folks to walk away from here with, is that, as you mentioned, Dr. Molthrop, a few minutes ago, and you just punctuated, Dr. Castrellon, that the hospitals, if there's any place right now that has it down pat what you're saying and what you're assuring folks is that the hospitals have the best system right now for making sure that if you go in, you're not going to contract the coronavirus. And Dr. Molthrop, a few minutes ago, you said actually that other people should follow those models, and you're probably correct. You're probably correct. So that's going to be the key, right? That's going to be the key to opening up our society. I think you both answered the next question that came in from Simona Latera. She says, I'm a survivor, stopped my massage therapy for the lymphedema and also my checkup. What can we imagine about the short future? Is it safe to start massage up again, and as well as my checkups? So it sounds like the checkups, from what you're saying, would be a yes. What about things that are, I was going to call it an extra item, but for lymphedema, massage is pretty essential. What would you say?
So, I mean, I think just similar to what we've echoed, I think it's going to depend on each physical therapy center, even when we get to the point where we're trying to get haircuts again and things like that, if I had a business like that, I would try to set it up in a way that I could assure my customers that, or patients, that this was as safe a place as you could have, with screening and making sure that my employees are screened, that the patients coming through are screened. And when we set those things up in places, then it will allow a level of comfort and safety that would say that that's okay. Places that aren't used to doing that are going to have to learn how to do that. Because even if everybody says we're going to open everything up, people aren't going to go, or many people aren't going to go until they feel that they're safe. So it may be difficult, it may cost more money and so forth, but my feeling is if I had a business that was like that, I'd find a way to be as sure as I could that my employees and my patrons are going to be safe when they come here. And then I'll probably have a more successful place than the person who's not doing that.
Yes.
It really is going to be dependent on the place. That's what I think. So
I think that's true. I was just going to interject maybe a little humor. I'm looking forward to the day that this salons are back open. I recently had to cut my husband's hair. True story. It looks okay. It looks okay, guys. I don't know. All right. This is a question for you, Kim. We have Yvonne Ramirez Rivera. She wrote in and she said, I'm now on my pill for 5 years. I'm not sure what precisely the medication is, but she's very interested in talking more to online support groups. Can you direct her a little bit? I know we touched on it. Just what can you tell Yvonne? What can she do?
Sure. So we have, Gilda's Club has support groups almost every day of the week. We have some in the day, some in the evening. We have the breast cancer support group that's specific to breast cancer coming up. The first thing that she wants to do is to call, and we'll find out, we'll do a screening over the phone with Yvonne and find out what all of her needs are, and exactly what she's looking for in the group, but some of the other things that she might need besides support group. Some of the anxiety and the depression that people are feeling might be from some of the, the other determinants of health that we don't think of: the environment, housing. Is she working? Did she lose her job? Does she need food? Those things are really important. And so we want to find out all of those things before we say, oh yeah, the group is on Monday night, just, we'll send you the Zoom link and you can come on the group. We want to know those other things. We want to work with her also individually and make sure she's getting what she needs in addition to the support group. And then she can decide for herself what she wants to take advantage of that we have and what she doesn't.
Of course, and that's so essential to provide that for folks. And I can also add in that if you just go, Yvonne, to floridabreastcancer.org, we have, and you do too, I know, on Gilda's Club South, we have a complete list of resources, everything from food banks to if you need financial assistance during this time, if you've lost your job during this time, there's extra funding for things like that. Florida Breast Cancer provides direct services. There are plenty of options. There's Gilda's Club and so many more groups. You are not alone. I guess that's what I want to wrap it up with, right?
And I think also Yvonne may be alluding to the fact that that she's been in treatment already for 5 years. I know at Gilda's Club, that's okay. You're still welcome and to be part of our community. You don't have to be newly diagnosed.
No, hey, it's a club. It's a club, really. And once you get to the other side and you're a survivor, we welcome you. And actually, you become an inspiration for the others that just entered the club. And that's kind of the model, right? So Yvonne, we hope to hear from you. We do. We hope to hear from you. Okay, a new question from Cheryl Outland. She's a breast cancer survivor and one of our very active volunteers here in Central Florida. What are the chances of a difficult flu occurring in the fall as a result of this virus? The two doctors, Dr. Molthrop and Dr. Castrellon, you are working so well together, so I'm not assigning questions. Who wants to take it?
Well, I think that they're two different viruses. This has kind of been out there in the lay press and in the sort of, we've heard it from patients before, but the flu is not the same as this current coronavirus, and they're not going to merge and become a super virus. I think the concern has been that if there is a second wave, that it may come about around the same time as the typical seasonal flu, and then patients could have dual infections, or hospitals could be overwhelmed because they'll have their normal flu season and now they'll have the coronavirus on top of that. And I think that's kind of the perception. They're two different viruses. It's a different situation, but if they're both active at the same time, there's a real potential problem for stress for the healthcare system. And I think that's kind of what's been out there, but been a little bit confusing.
Dr. Castrellon, did you want to add?
I think this is so new that we don't really know. We don't really know how is it that it's going to be clear and how long is it going to stay, and if it's going to follow the same behavior as the influenza virus, that it's just an endemic. It's an endemic infection that we deal on every year and mutates, and vaccines have to be developed every year for it. We don't even know if we'll have a vaccine for the coronavirus. There seems to be one. I think Canada is reporting some data there that maybe by the end of the year. So, a lot quicker than it used to be. So I certainly hope so. But I can comment on the possibility that we'll have an influenza and a coronavirus. Hopefully not.
That's fair enough.
The only thing I can do to prevent that is pray. I'll pray a lot.
We're all doing that right now. There are definitely some unknowns, and that's what makes it even just a tougher situation to maneuver. This is not a question that came in, but I do want to ask it. I was speaking to one of our volunteers who's a 20-plus year metastatic breast cancer survivor, an amazing woman, truly, and she's become a bit of a leader in Central Florida for those folks who find themselves diagnosed with metastatic. And she was a little down the other day when we held one of our volunteer meetings via Zoom, and told me that a friend of hers had just been diagnosed with metastatic breast cancer and was told that a mastectomy anytime soon was off the table because it was not essential. Now, again, this was a week ago, so things have changed. I might be able to answer it based on what you've told me. But I guess maybe we'll broaden the question, because this is something that's been on my mind, which is there's a lot to come from this. We're telecommuting. You saw my daughter. We're all learning to work from home. We're learning to do things different. We're learning to do outreach. Do you think that there might be a change in the way that essential services and non-essential are looked at? Do you think that there's going to be a different sort of approach to certain ailments, like let's take metastatic, because of this, because of COVID, because of that moment when that doctor told her that's not essential? When my friend, who's a 20-plus some year survivor, says that time is of the essence, and we know it is.
Dr. Castrellon, you want to address this?
I have to look at that case. So it's someone that has been recently diagnosed with breast cancer that doesn't have a metastasis, or the person has
metastatic, and was told a week ago by the hospital she was at.
Newly diagnosed.
Yes.
With metastasis.
Yes.
From diagnosis.
Yes. And I'm hearing this secondhand, but yes.
Yeah, I'm not sure surgery would be indicated in that setting anyway. typically. So
Right.
typically we would treat that first, and then surgery would be a discussable point if you had an excellent response systemically. That's debatable, but
Yes.
so it's not wrong to delay surgery in that particular incident, I would say.
Well, I know from the conversation I had, and again, I'm hearing this secondhand, I don't think it sounded as if the conversation went something like this. The mastectomy, we all, she knew that that was a good option for her, and she was just shut down and told that that was a non-essential.
I tell you what I have experienced recently. There were some guidelines that were given for surgeons, and I think the guidelines were mainly to preserve the essential masks and all of the OR equipment that was necessary if a surge came, and we were prepared. We prepared meeting rooms with beds and oxygen and halls. The hospital was prepared for a huge surge, so they were also saving equipment that was going to be necessary if more healthcare personnel had to be involved with the COVID. So I did have some cases of patients that would have usually had their surgery first, whether they had elected to have a mastectomy to treat the primary breast cancer or a lumpectomy. And at that time, the surgeons were not operating. So these patients were told, we cannot operate you right now. The OR is closed. It's just for emergencies, etc. And time is of the essence of breast cancer. Everybody keeps talking, the earlier we're diagnosed, the better the survival, early stage, and etc. And I agree with that. So what we did with those patients is that if they were hormone receptor positive, what we started was the anti-estrogen therapy. And I'm just going to use this term a little lightly, but it's like to keep them on ice so that we know that these treatments are effective in delaying the progression. We know that they are safe in preventing the appearance of metastasis. That's something that we could do for a couple of months, obviously not a long-term treatment, but 1-2 months, etc. And now those patients are going to slowly be assessed, addressed again. I don't think anything's going on with them in terms of a progression. These were small tumors, 1-2 centimeter tumors, and they will be operated, I believe, June, July, even May, they can start getting surgeries again. So possibly what the person was told, and this sounds to me that she had an early stage breast cancer, that she wanted to have a mastectomy, and she was told by the surgeon that it was a non-essential procedure at that time. Maybe that was the case, but she could still be operated at some point as long as they don't leave the tumor untreated and just say, come back in 3 months. It depends on what type of tumor it is. We cannot do this with other types of breast cancer that we can manipulate them hormonally and they're going to stay the size they are, So I will have to see the case and see exactly what happened there. But that's just a guess of mine of why the surgery was called non-essential and delayed in someone.
Yeah,
If the person
we
didn't
don't
have
have the
metastasis.
whole scope, but thank you. Here's a new question from Beatrice Milan. How safe is it to start radiations at this time?
So again, I would say that the radiation facilities and the surgical suites and the hospitals and doctors' offices, for the most part, are spending a great deal of time trying to make sure those places are as safe as any place that you can be. And so, we know that delays in radiation can be problematic. There's a number of studies showing that if you wait too long, that they're less effective and so forth. So I certainly listen to my doctors and recommendations, but I think that the two issues are, one, is it safe to go to the facilities? Yes. Two, am I going to be at increased risk of having complications from COVID-19 because I'm getting radiation? And I think that's more of a gray zone to me. I think you probably have some immunosuppression, certainly with radiation, but I would not put those patients in the highest risk category. And so I would certainly recommend that if a patient is supposed to be getting radiation based on a regular timeline, that we shouldn't change that timeline for this at this point. I'd be curious if Dr. Castrellon would agree, but
Same here, yes.
Thank you, gentlemen. Good information. Beatrice also wants us to write down the links for support groups and also for financial aid for breast cancer patients. And again, Beatrice, I'll tell you that you can go to floridabreastcancer.org, and there's a COVID-19 resource page. It is all right there. And Kim, if you want to share your information for Beatrice.
Sure. You can also go to Gilda's Club, southflorida.org. Just spell each word out, Gilda's Club, southflorida.org.
Okay, so two good options, and you can get everything you need, Beatrice. So, and if not, just pick up the phone. We'll help you. That's what we're here for. Okay, another question. Carolyn Newman, I've been hearing about increased stroke cases related to COVID and want to know if women taking drugs like tamoxifen have increased risk.
Interesting. So yeah, I don't think there's any data right now. It's been interesting to me, and I'd like to hear your opinion too, Dr. Castrellon. This is because it's a new entity. As physicians, when we see something, we want to know more about it. And so every subspecialty has looked at this disease from their own perspective. A little bit like the blind man describing the elephant. We each have our own perspective. And so it's not surprising that in the sickest of patients who have these overwhelming viral infection, which, as Dr. Castrellon clearly points out, is a small percentage of the patients. But in those patients, they've been studied by hematologists, by nephrologists, by cardiologists, pulmonologists, every subgroup of medicine we have, and they all describe terrible things happening, okay? And this is not untrue of all overwhelming infectious processes. When somebody gets critically ill, multiple organs will be affected and affected. So it doesn't surprise me that there's a hypercoagulable process that goes along with this and that's been described. And yes, there may be increased risk of stroke. But for the average patients who are exposed to COVID-19, most of those patients will have a much less severe course. And so I certainly would not recommend somebody on anti-hormone therapy to stop their anti-hormone therapy during this pandemic. The consequences of that could be profound. And we always talk to patients, especially on tamoxifen, if there's a risk of thrombosis for other reasons, we're going to look for alternative treatments anyway. But this would not be one of those reasons, at least in my mind, based on what I see so far.
Yeah, I agree with that. I just want to say hi to Carolyn.
Okay, then that's your question. All right, I'm sorry. You have better, well, I shouldn't say, you have very good patients who are paying attention. Good.
Well, I hope you're in agreement, Dr. Castrellon, with Dr. Molthrop there.
I agree. I didn't even know there was a relation with the COVID and thrombosis, to be honest.
Yeah.
And I assume this is something that is being described now in the patients that are presenting the respiratory distress and are ventilated. Correct. And, you know, and acute respiratory distress, you know, they go into DIC probably because of all the multi-organ failure and yes, thrombotic events can happen. But I would not recommend to anyone that is on tamoxifen to place on hold their anti-estrogen therapy at this point in time during this pandemia because of concerns of a thrombotic event. No, I would not.
Thank you, doctors. You know, Kim, what we're hearing, a lot of these questions, there's so much fear and confusion. And doctors, I don't know if you know this, but a lot of my career was spent in the media, and I have varying opinions about what I've been watching, and I could hear you do too. It's been good and it's been bad. Kim, what are you hearing when you're talking to your constituency? I mean, how concerned are folks and how fearful are they, and are they just not getting the right information they need? What are you hearing?
So we have the whole spectrum. Some people think they're going to die because they have cancer and they're hearing that they're at risk, they're immunosuppressed, and just because they have cancer that, you know, they're more likely to die because of the virus. We have some people that never turn the television on and don't want to hear it because they don't want to hear the negativity. And some people who are in front of the television every single day and can repeat everything that was said obsessively. And so, you know, there's a balance to all of this. life goes on. There are things that we know. The sky is still there, and the sun is still there, and we know that we have to get up every day and live our lives, and there are things that we control and things that we can't control. And we try and focus on what those things are, on what we can do, on how we can support one another. We're doing a lot of healthy living classes, anxiety and stress relief, and mindfulness on a daily basis, because people are sitting at home and it's hard to not go in and turn the television on or the radio on and listen to what's going on. And I noticed on television, they stopped putting how many people are infected and how many people have died nationally and globally all day long. They put it on the television. It's still on the news, but it used to be there all the time. Yeah, on the side of the screen, even if commercial was on. It's hard to not absorb that information. I think about the nurses and the doctors that are working in the ER. They're experiencing trauma on a regular basis. And there's a psychosocial effect to that. And there's a psychosocial effect to people watching the news and the television all day long and taking in that negativity. Everything in the world is not negative, and we have to have a balance and put things in perspective. And I think the mindfulness programs, and Gilda's Club has them, there's a lot of them. They're all over the internet right now for free. And the reason why you see them there for free is because people who work in my field know that there needs to be a focus. We need to quiet our minds, and we need to put things back into perspective. Things will change. Better days are ahead of us. I can't tell people exactly when we're going to open or what it's going to look like and what we're going to be able to do and not be able to do, but things will get better.
Yeah, one thing I just wanted to add, I think, Kim, you're remarkably articulate, and I can tell that you're a remarkable resource to patients and to people who've been through what our patients have been through. So kudos to you. Really, I think you say things beautifully, and I'm sure that people have taken great strength from that. So thank you. Just a couple of things, and I apologize, but I heard, like, you know, Fred Rogers, Mr. Rogers, like, said when he was a little kid, it's hard to have perspective when you see things on the news and saw disasters. This is way before any of this happened, obviously. And he said his mother told him when he would see something like that that disturbed him, that you should always look for the helpers. And whenever there's a disaster or a difficult time, there are the helpers, the people out there that are trying to make things better for the people going through things. I think this pandemic has shown that over and over again. We talk about the nurses and the doctors on the front line, and absolutely amazing what they're going through, but they're the people who clean the rooms after there's been a code, and there's the people who check in people, and maybe they don't have quite as much of the equipment and so forth, and they're just thousands and thousands of people who are doing really remarkable things in a difficult time, and it's a testament. And it's cancer patients, if anyone, should be able to relate to that, of what they saw when the people around them helped them through things. And sometimes when they felt alone and abandoned because people didn't understand, but yet there's somebody out there that reached out to them. So there's a lot of things they can relate to, I think, to the outside world, and trying to be a little more outward focused and reaching out to your friends or other patients that you know in your group and so forth. Those are all things that we can do that can maybe turn some of this negativity into a real positive thing.
Agree. Let's try to squeeze in a few more questions. We'll just kind of buzz on down a few. We got about 8 minutes, so we'll try to do it in bullet fashion. Latoya Hobbs, I'm currently on chemotherapy and hormone therapy. I just did treatment today. What are my risks? What can I do to boost my immune system? Gentlemen.
We get asked that all the time, even without the COVID-19 infection.
Boosting?
And, you know, you get chemotherapy, and you know, when we look at immune system, people often focus on white blood cells. I got my Neulasta injection that boosts my white blood cells, and yes, it'll help you fight infections, decrease the chance of fever with a low white cell count, etc. But chemotherapy affects specifically the type of immunity that we talk about these days when it comes to fighting viruses, especially because that's more of our T cell system, immune system. And we don't really have much to boost that up, although there's a lot of stuff that you will find at GNC and places and all kinds of things that claim that they boost their immunity, and you know, they make a lot of money selling those things. And honestly, the usefulness of those products is something that we've always questioned, since there's really no prospective clinical trials or data that proves that any of these things is really effective. You know, so I've been the type of person that usually recommends a multivitamin twice a day or once a day, even during chemo. I don't see a real reason why not to take some B12 folic acid and iron and things that you need for your bone marrow to be functioning well. But when it comes to boosting your immune system while you are receiving cytotoxic treatment for cancer, that's something that, you know, good nutrition, rest, try not to stress yourself, good hydration, exercising, that's what we focus on, really. But as of products and things that are really going to have an impact on that, I'm not aware of too many of those, if any.
Yeah, and in fact, the biggest studies with supplements with chemotherapy would suggest potential interactions. So try to keep it clean. Exercise actually is probably the single best thing we could do for our immune system. Nothing has shown to be more effective than exercise in terms of the way we fight off infection, both T cells and B cells. It's really an amazing thing. I know it's impossible when you feel as badly as you do through treatment, and it's easy to say, but boy, if we could get patients even just to walk and move and groove through treatment and after treatment, I think we could do an awful lot. And sometimes that's our job, is to try to motivate a little bit better that way.
And it's a great way to boost your immune system, even in regard to COVID-19, just in general.
Correct. Correct. As long as you're keeping social distances.
And you can do that online right now too.
There you go.
Lots of yoga classes. All right, we'll squeeze in this last question from Carlin Taylor. What if you're scheduled for your monthly injection for breast cancer treatment and you develop a cold or flu-like symptom a day or two before the treatment? How is that handled? Would it be canceled? Would I be required to get tested for the coronavirus?
So I'll just say what we're doing in our center, and I'll pass it on to him quickly. And right now, if you're screened and you have a fever or you have the symptoms consistent with that possibility, we're not going to have you be able to come into our center. We ask patients and so forth that we screen. And depending on the clinical scenario as to whether we recommend getting tested for COVID-19, but we're not going to have patients who are potentially sick, even if it's not COVID. We don't want patients with fever, coughs, and things like that in the treatment room. So we'll postpone, reevaluate in the next week.
Dr. Castrellon?
That's what's been happening at the center as well. Like I said, we've had cases where patients tested positive, they were quarantined, and now that they have been retested, they're coming back to have infusions again. I had a patient that was in the middle of chemotherapy when she contracted the virus, and she's resuming now. There was a delay of about 3-4 weeks, you know, but we had to. Now, I think Carlene's question is somebody that's getting an injection to suppress the ovarian function. Sounds like it's somebody that's a premenopausal patient, and probably on an aromatase inhibitor, and that person is due for her monthly Soladex injection and is having symptoms concerning for a coronavirus injection. A coronavirus infection. What we recommend is to, if you have the symptoms, just like Dr. Molthrop, right?
Nobody can say that. That's okay.
Just like David said, to get tested. We have a facility near the hospital. Civic Smith Park has been doing thousands of testing, and they're testing every day. Now they're even testing asymptomatic patients that want to know if they're infected or not. Now, if that patient is positive, needs to be quarantined for a 2-week period, what happens to the Soladex? This person is concerned that she may have starting her menstrual period again and not, receiving the injection that's given to block the ovarian function. I think a 2-week delay may not be enough to have that patient resume menses and ovulate. And obviously, if there is menses, we will stop taking the medicine right away and maybe switch to tamoxifen for a period of time. There's different options. But I would say first to get tested and depending on the result, getting the Soladex injection. But with symptoms, will be tough to come into the center, like David was saying, because we are really being very careful with patients that have had symptoms of an upper respiratory tract infection. And we have to remember that there's many other viruses and many other illnesses other than the COVID that we commonly get. So I think testing in that particular case on that patient it's key to know whether that person can come to the center and resume monthly injections.
All right, thank you.
Give your physician a call. He will instruct you over the phone very well. So call your physician, whoever that person is that's having that. I know he will be more than happy to help you with that.
That's an excellent point. Everyone's available by phone or by computer. Believe it or not, guys, this is an hour, and we probably should have gone for 2. We have more questions. So I guess the folks that are watching, I'm going to ask you if you've enjoyed this and if you have found this useful, please shoot us an email or send us a comment, and we will be sure to offer you this opportunity again. To the doctors, Dr. David Molthrop. Oh, that's my daughter cheering in the background. Yes. Apparently she liked it. Great job, everybody. Yeah. Okay, we are wrapping it up, sweetheart. Yes. Okay, we're going to actually do a social distance bike ride in a bit. Dr. David Molthrop, thank you so much for your time and your insight. Absolute pleasure. Dr. Castrellon, so appreciated. So much good information. And of course, Kim, an absolute pleasure, and I love partnering with you and working with you. And we will continue to do what we do. And again, to everybody watching, we are here for you. You are not alone. We are just doing things a little differently. And but we will make it through together, I have no doubt. And just a little note for folks right now too, if you are at home and if you've had the time, I know some people have, to clean out your closets and tuck some of those things away. Our Pickups for Breast Cancer just emailed me and said that they are looking to reopen on Monday per government regulations. You can hold on to those things. I know we've gotten a lot of questions. You can leave them outside of your door. They will not be coming in due to social distancing, but you can get that back up and running on Monday too. Anyway, please everyone, be safe, be well, and I look forward to doing this again if you're all game.
Thanks, Tracy. Thank you.
Thank you. Nice to meet you, David.
Nice, you too. Stay safe.
Bye, everybody.
Bye, everybody. Thank you.
Bye.
Bye.
Bye, beautiful.